can just I can get this big old thing out of the way. I'll let you get comfy with that. We'll get it wet first, and then we'll go through it with the brush. So, sorry, got it filming. I do have more shampoo with me if you need more. Doesn't mind it at all.
No, but I just said it was good.
You need like a little more soap, or go through it with this. There still might be a little bit more little particles, so I do think probably at least just to maybe on the brush a little bit, just to kind of get through some of that. Some of the. Oh boy, she likes that. Doing great. Alright, I think I got perfect.
As much as we're going to get off of that.
That's perfect. So then we'll take this and we'll just kind of dry her little head. I know, so tender. Do the best we can with that. Oh, pretty girl, your hair is just going to be so beautiful after this shampoo. Alright. And we'll put a clean hat back on her. As that head gets a little less, I mean, obviously it's going to be sensitive for a long time, but a little less sensitive, you can give her another one later. That's good for now. So while we're here at the sink, we'll do one more thing, and that's just washing her face. We don't use soap on her face. We do the rest of her body. So this is just a clean washcloth. And as long as you're comfortable, I'm happy to do whatever you need from me. Oh, it's okay. Alright, yay, perfect. You did great. Alright, so we'll just go put her on our little bed and we'll give her a sponge bath and we'll be good. good to go.
Oh, you did so good. That was so sweet.
And I would say, I think probably if we do the bath a little bit closer, just with that little blower, so it can be a little chilly. This pile here, that. And then this will just kind of, I've dried it off, so this will just be kind of ready for you to keep for later if you want it. And we'll fill up the bath water and you can kind of layer there and we'll get started.
Here you go.
Oh, she yawned. I always just kind of set that at the foot of the bed and just kind of put her in here as best as you can. And I know, again, that you know, it's not too complicated, but
No.
you'll just do kind of the arm and the upper chest and stuff first, and you'll dry. So I've got plenty of washcloths over here, but you'll kind of dry her off as you go so she doesn't get too cold. Yeah, perfect. Usually I like to switch mine out, so maybe just the two arms and then maybe move on to a new washcloth, that kind of thing. So. It's always tricky those first, like kind of under the crevices of like the elbows and the armpits and stuff. So just, you know, the best you can because they're a little bent right now.
Oh, it's okay. It's okay, sweetie. Oh, doesn't make you mad. You didn't like
She's
this.
like, I was so happy and now look at what this nurse is making me do.
She does not like her armpits to be messed with.
Oh my, yeah. Okay, yeah. Oh, I know. This is the worst part, baby girl, and then you'll feel so much better. You will. Sometimes under their neck. So right now it's the vernix, but you know, in the future it might be some breast milk or even just a little sweat. So neck is always a good place to make sure you try to get under. And the ears are a little tricky right now because they're so small. So she'll kind of have some vernix in between those ears. We'll actually do that last because we'll flip her over. Okay. So now we'll kind of head to the legs and feet. Right? Yep.
Oh, shh.
Back of the knees are kind of always another tricky spot with all those goodies. But so you'll continue to do these sponge baths until that cord falls off, which is usually like 7 to 10 days. So we just want to keep it dry. Yeah. So now if you got all those parts, we can go to her little bottom and we'll save that last one for her back. And yep, this is dirty, so we'll just get rid of that. I'll help you take this off. And got a little bit of poopsies, but we'll get that. She may decide that she needs to go more. And of course there's some vernix in between those little legs, little legs. So she pooped and peed, so I'll record that.
you're just so good.
Now when you're cleaning a little girl, inside the labia, especially at the beginning, she'll have some maternal hormone. So that little whitish discharge you see is totally normal. Don't spend a lot of time trying to get that out. That would actually kind of hurt her a little bit. So just her body will reabsorb that. So just delicately wash, and it'll be fine.
It's okay, sweetie.
Perfect. Okay, yep, that sounds great. Sweet girl. So I think we'll just move that down a little bit. She should be good right there.
Can we just...
Absolutely, yeah, that's fine. That will make her happier anyway.
There you go.
Now, right now, her little skin is nice and pink and just perfect. One of the things we'll check until you guys go home is her jaundice level. So if she starts looking yellow or anything, we'll be watching for that. Now, this is a clean bed, so you're welcome to put her in it. I'll go ahead and I'm going to finish my assessment on her so I can get her little gown on and stuff. But that's pretty much the extent of it. Their little skin, as you know, is so sensitive, so really baths are necessary only about every 3 days or so. They certainly don't need one every day.
Yeah. Certainly not.
Alright, so we can do that, and I'll put a little diaper on her and her clean gown, and then I'll get her swaddled and do your assessment, and things will be hopefully pretty good, huh, Missy?
Oh, yeah.
Pretty baby girl. Does that feel better? Does that feel better? Oh, I know it.